right, these are my 5 people. All right. So if I asked everyone to point out a fire extinguisher or an AED, most people probably could. But what if somebody was having an opioid overdose? Would anyone know what to use or where to find something to help? Would anything even be nearby to save their life before EMS arrived? Well, in 2024, according to the National Safety Center, 54,000 opioid overdoses in the US happened, which is about 148 each day. So a little credibility, as an EMT student, I'm trained to recognize overdoses and how to treat them. And today I'll be talking about how Narcan should be widely available to everyone in all public places such as schools, airports, restaurants, malls, parks, or big stadiums like that. So, the problem of opioid overdoses. A little bit of background. Opioids are like prescribed pain medications. A lot of ones are like fentanyl, morphine, oxycodone, and then there's illegal substances like heroin.
Nice.
These can cause addiction, which can lead to overdoses. According to the CDC, an overdose can look like slow breathing, which has the lack of oxygen, and then can lead to brain damage, and then that leads to death. So how Narcan works. Narcan is the brand name of naloxone, which is the actual drug. It comes in a nasal spray form. You put it in someone's nostrils. It sprays like a mist, which binds to glands in your nose, which enters the bloodstream quick. So, according to the Substance Abuse Mental Health Services Administration, the naloxone pushes opioids off of receptors in your brain because the naloxone is a lot stronger. So though it pushes them off, the naloxone temporarily blocks the opioid effects. So when that's administered to someone, in about 2 to 3 minutes, you'll see breathing improvement, but it does only last 30 to 90 minutes, so we always call 911. So how would a bystander know? For opioid overdose and cardiac arrest, a lot of the effects are very similar. So to kind of recognize the effects, for overdoses, a person's not going to wake up. They'll have very slow breathing, very slow pulse. Their skin will be almost gray, pale looking, blue lips, blue fingernails. If you lift up their eyes, they'll have pinpoint pupils. And then agonal breathing, which is just not breathing that's not normal. So you'll hear gurgling or snoring sounds. And then again with cardiac arrest, they'll be unresponsive, that agonal breathing, but they'll have no pulse. So either way, you should always do CPR, find an AED, and then again, always call 911. But if an overdose is suspected, it doesn't hurt to give Narcan. It doesn't do any damages. So if somebody is in cardiac arrest and you suspect an overdose, but it's not, you can always give that. It doesn't do anything. So my solution, I think putting Narcan everywhere, that we keep other resources like fire extinguishers, AEDs, stuff like that. It should be widely available just like that in schools, airports, malls, parks, restaurants, big stadiums. The benefits of having Narcan: it saves lives before EMS arrives. Every minute counts. It's very easy to use and it's safe for bystanders to use. It gives people a second chance to receive treatment. And then according to the National Institute on Drug Abuse, overall increased naloxone access it's linked to fewer overdoses. And then my conclusion, opioid overdoses are preventable deaths. Narcan is simple, safe, and effective. Every public place should have Narcan available. Just like CPR can save a heart, Narcan can save someone who overdosed on opioids.